Hi everyone, thanks for being here. This project explores the land-well-being connection for Indigenous peoples in the Circumpolar North. This research is led by Dr. Kimberly McGinnis at the University of Alaska Fairbanks. The idea of this research is simple but important. For many Indigenous communities, land is not just a physical place, it is deeply tied to physical, mental, and spiritual health. So the question guiding our work is, how does land contribute to Indigenous well-being? To answer that, we conducted an integrative literature review that spans from 1999 to 2024. We focused on the Circumpolar North because these are communities that are particularly susceptible to rapid changes driven by climate change, industrial development, and the lasting impacts of colonial systems. One of the key findings is that the research has grown quickly, with nearly 70% of studies published just in the last 10 years. Most of this work is concentrated in North America, particularly in Canada. And what we find is that the research spans multiple disciplines. Public health made up about 75% of the literature that we have reviewed so far, followed by psychology at 35.7% and social sciences at 25%. Environmental sciences at about 10%, and a few other disciplines scattered throughout our project so far. But even though this is a growing and multidisciplinary field, as you can see, it is fragmented. And so with that, we find that different disciplines are going to be using different terminology, frameworks, and methodology to define and measure well-being. Often these Western academic approaches do not fully capture the Indigenous perspectives. But we do see some clear themes that emerge across the literature. The main one being that well-being is not individual, it's collective and relational. It's grounded in land, culture, and community. This means that when access to land is disrupted, whether that's through environmental change, policy changes, or urbanization, it doesn't just affect resources, but it affects identity, knowledge systems, and overall well-being. So what we find is that the literature highlights some land-based interventions in order to mitigate some of the negative effects of these changes. One of these being culture camps, often led by elders, that center on seasonal practices and cultural transmission, as well as traditional harvesting activities. The aim of these interventions or these culture camps is to promote knowledge sharing, culture retention, and promote positive emotions while strengthening social and community connections. I want to emphasize that this work is still ongoing. We're currently expanding the scope of our review to strengthen the rigor of our analysis. We expect to include roughly 100 more articles, which will help refine these findings. But overall, the takeaway is that if we want to meaningfully support Indigenous well-being, we have to think beyond the conventional health frameworks, and we have to support land access, stewardship, and self-determination, as these are central to well-being. Well, I thank you for your time, and I hope that you will reach out to us if you have any other questions. Thanks.